Yes, I think getting mammograms is very important because we can find cancers that we can't feel. So the only way we pick up these cancers is on mammography, and they're very, very small. So what that does is it decreases the amount of treatment that you need, and your survival is much better. You know, having a mammogram is really not that painful, and when you think about the fact that your overall survival is going to be improved, you should definitely have a mammogram once a year. We are treating breast cancers differently than we did, say, 10 or 15 years ago. We're still doing lumpectomy, so that part is the same. So we're still taking out the breast cancer with some normal tissue around it. We're doing less lymph node dissections. We're only taking out one lymph node from under the arm. So that makes the surgery much less painful, and you can recover much more quickly. I think the take-home message is that breast cancer is very treatable now, especially if it's picked up on mammography when it's very small, that we've reduced the number of women who are getting chemotherapy. A lot of women are getting aromatase inhibitors now or other anti-estrogen pills, and that's because we have more genetic testing on the cancers themselves. So we can actually look at the cancer, see if it's an aggressive cancer or not, and treat it appropriately. So we're not using chemotherapy on every woman, so you don't have to worry about that. And I think that's the biggest fear that most women have is the chemotherapy and hair loss. So whether they're going to need chemotherapy and whether they're going to have hair loss. So I think on a case-by-case basis, a lot of women are having very minimal and not invasive treatment. And that is the reason that mammography is so important, because we find these cancers when they're so small and they can have much less treatment. Breast cancer is definitely not a death sentence. Most women survive breast cancer for many years. And actually, most women are cured of their breast cancer.